So the idea to do this session, for parents of young children between the age of 2 to 8 or 2 to 10, essentially a lot of parents, see their children in this age group get a lot of, cold or cough or very frequent viral infections, very, like a runny nose. So we just kind of wanted to understand from you, as a chest specialist, as also as a mom of two very young children, what are some of the things we could do as parents to help children, whether it's build better immunity, whether, it's getting the right medication on time, whether it's any vaccines we can take to help build, help them sort of get these infections less, or at least help their bodies cope with these infections in a better way. So let's start with, what are some of the common respiratory illnesses that you see in your clinical practice for young children?
Yeah. Hello, good afternoon, everybody. Thank you for joining us on this relatively less gloomy Friday afternoon. Thank you, Jaisal, for having me over. Uh, uh, it's not going to be more of a one, it's going to be more of a one-to-one conversation than me being a doctor, because, of course, me being a mom takes over everything at
Yeah,
most point of time.
yeah,
So, and what I've learned in the last 4 years of being a mom is more than what I've learned in 15 years of being a doctor. So, let's just discuss the practical points, and I will try to address as much as we can.
sure.
Coming back to Jaisal's question, what respiratory illnesses we commonly encounter. There is a fact that every child on an average all over the world suffers from 3 to 8 episodes of cough or cold every year. So,
Oh,
if a child is getting uh, an episode on an average, say every 2 months, which is 6 episodes in 1 year of either cough or cold or both, then
mm-hmm.
it is very normal. Then he is in the normal range.
Okay,
So, that's the first thing that why we should not panic in a situation like that.
sure.
And secondly, anything ranging from some children have a dry hacking cough, which is the main issue. Some children have a persistent running nose. Some
Yeah,
children do have a tendency to catch a fever much more than other children. And yes, of course, there are a few unfortunate few who do develop an asthma, who do develop
yes,
wheezing, who do need inhalers. There are various terms for all these ailments, right from a viral cold or a croup or a bronchitis or a bronchiolitis or a wheeze associated lower respiratory infection.
yeah.
These are more for us to classify, but for you as parents, what we have to primarily see is how sick the child is getting, when
Mm,
to seek medical attention, when to self-medicate,
yeah,
and what are the red flag signs.
yeah, yeah.
Yeah.
Understood. So, like you mentioned, you touched upon asthma, you touched upon a wheezing cough. So, primarily, even as a parent of a 2.5-year-old, the first episode when my son had, what started as a viral, eventually became a really bad congested nose and a deep cough, which was very, very deep within his chest. Like I could see his whole body kind of vibrate every time he coughs.
Sure.
So the concern here, for a lot of parents, is that how does a small baby or a small toddler expel that phlegm?
Sure.
Because we can almost hear it build up, from their lungs right up to like their, nasal chamber. So they find it very difficult to expel phlegm, which, adults don't seem to have that problem. So
Sure.
what according to you is the way for toddlers or young children to expel phlegm, and how do we as parents at home ease that congestion?
Sure. So, see, there are a lot of myths, in this, that some people forcefully make the child vomit to expel the phlegm,
Hmm.
or some people feel that it comes out in the child's potty.
Hmm.
Um, Honestly, actually, if we start with, the phlegm is basically what we call as mucus, is basically a protective mechanism by the body. Okay, it is a protective mechanism. It traps the viruses, it traps the particles, and it tries to get it out, so that it doesn't go deeper into the body. And the cilia, the normal movement of the respiratory tract
Hmm.
of children or adults, kind of get it out. So this is
Okay.
a normal mechanism. When a child is infected, okay, when a child has got a viral, of course the quantity of phlegm does increase, because the body's reaction is to catch more of the virus and get it out before
Yeah.
it enters deeper inside.
Okay.
So that's the logic behind the phlegm. Similarly for the nose also. So these are the two passages of entry. One is the mouth and one is the nose. But
Okay.
if generally there shouldn't be anything harsh done or special done to get the phlegm out. It will go on its own, in its own
Okay.
sweet time. Okay, if a child has a running nose, it has to be kind of cleaned from time to time. And if a child can't cough it out by any chance, the child can take any cough suppressants which are prescribed by a pediatrician, like an Alex Jr. or whatever cough suppressant, which would kind of reduce the overall coughing. The
Okay.
phlegm will definitely settle on its own, unless the child is really asthmatic or is having a bad fever, where at that point of time the child may need antibiotics beyond 3 or 4 days of fever.
Hmm.
Or if a child who does require inhalers or nebulizers, will the taking of the same will inhale the ease of the expulsion of the phlegm. But
Hmm.
otherwise nothing particular needs to be done. As the illness settles, as the child builds its immunity over the next like 24 to 72 hours, the phlegm will automatically reduce.
Okay. So it's good that you mentioned these myths, because our parents or grandparents, when they see their grandchildren, they can't help but say, "अरे इसका cough उल्टी में निकल जाएगा," या ये इसका potty. And you rightly mentioned that's exactly what the adults in the house, what the elders say.
Correct.
So they do things like they put a warm potli on the chest of the child, or they
Sure.
they forcefully get the child to throw up, which is very
Sure.
uncomfortable.
Sure.
Another myth, which I have seen is that there is a certain misconception that inhalers and nebulizers as a form of treatment is addictive in the long run. Which means that agar one time, once if your child gets used to the inhaler, if you might have given it in, when they have a serious chest congestion, or a nebulizer, means that every time they get the cough, you may have to nebulize them. So, can you just give us some information here, because there is a lot of talk around this, for young parents.
Sure. So, generally, how it goes is, whenever a child catches a viral, okay, may it be a cough or a cold, first thing is to do is to wait and watch, or take any normal cough syrup, or a mucolytic, like mucolite syrup, or a Alex Jr., or whatever it is. Once, if the cough doesn't settle over 2 to 3 days, or if the child has a severe wheezing, he has a drop in oxygen saturation, he has flaring of his alae nasi, he has fast breathing, he has his intercostal muscles are breathing faster, means definitely he's developed a spasm in the chest.
Hmm.
Spasm is basically narrowing of the windpipe. At
Hmm.
this point of time, the child may need to be nebulized. Now, whenever this happens for the first couple of times, maybe once or twice or thrice, generally, them being children, a child is given nebulization, which may be required for a day to 5 days. And it does not mean that the child will get addicted to it. It is, in fact, the best form of treatment at that point of time, because how many ever syrups or antibiotics you give will not relieve that congestion as well as the nebulizer would. So, if a child has to develop asthma in the long run, may it be genetic or may it be his own body, structure, irrespective of whether you give him nebulization or you don't give him, he will develop at the end of the day. So
Hmm.
it's not that if he nebulizes himself once, he may need it all the time. Sometimes people need it once or twice in childhood and never need it all their life, or they never develop their asthma.
Hmm.
Now, when a child who is falling sick frequently and who is requiring nebulizations every month or every 15 days, that point of time, we consider putting the child on an inhaler. So nebulization is more of a SOS or a rescue therapy. It is
Okay.
called a reliever therapy, which relieves the child of the acute problem. And it does a fantastic job. And mind you, guys, if your pediatrician or your pulmonologist or even your GP prescribes it to you for whatever reason, it is only for the best. It is not going to cause addiction at all. In fact, it will shorten the duration of his current illness and make him better much faster. Now, when the requirement of a nebulizer increases for a child generally about 2 or 3 years, and the child is falling sick or is wheezing very frequently, at that point of time, the role of the doctor is to start him on a controller therapy. A
Sure.
controller therapy is started by an inhaler. Okay,
Okay.
an inhaler kind of reduces the overall inflammation, allergies inside, and makes the child much more comfortable. And it generally, that also we require to give only for a couple of weeks, 4 to 6 weeks, 8 weeks, and then he may get rid of it for a long, long time.
Sure.
So and also one more thing, that if I see a lot of parents who say nebulization chalega, inhaler nahi chalega.
Uh,
So the this something which is to be kept in mind, that 2 or 3 days of nebulization has a dose equivalent to 1 month of inhaler. So the dose in an inhaler is lesser, much lesser than what is there in a nebulizer. So if it is required to take it by your doctor, by your pediatrician, then please take it, because taking a regular inhaler, if keeps your child away from a cough, it will improve him, like it will enhance his school performance, it will reduce his absenteeism, it will improve his diet, and what all mothers want, make him put on weight. So
yeah.
you know
Yeah.
so it's all a cycle, and it's not addictive, it's not habit forming, and it's the best therapy your child can get.
Sure. Sure. Great. I think that was very informative because this addiction problem is a huge myth that needs to be busted. We have another question. Does phlegm that is collected in the chest turn into pneumonia if it goes untreated for a long time?
No.
This
Yeah.
is why a lot of elders say that cough nikal jayega to acha hai, phlegm nikal jayega to acha hai. So, do you think that a prolonged cough can eventually turn into pneumonia?
No, not at all. If pneumonia has to happen, it will happen right from the start. And generally, a pneumonia is accompanied with a high grade fever. And the child is quite toxic. Child is quite sick. He's not eating. He's very lethargic. He's quite unwell.
Sure,
So pneumonias just don't happen by a persistent phlegm. Phlegm may be there, but no, it will not turn into pneumonia.
sure, sure. And does steam inhalation help with relieving congestion in the nasal chamber or, lower? Do you recommend that to parents for home
Uh,
treatment?
Yes, always a big fan of steam per se, not from the COVID point of view, but yes, it does decongest the sinuses. It does help for a lot of nasal symptoms, a lot of coughing, nasal congestion, and for children who have a persistent blocked nose. With regards to cough, if your child is coughing a lot, then please don't use steam. It does not help. It will only irritate the cough more. But
Okay,
yes,
so
if the nose is a bigger complaint, if it's a blocked nose, especially little elder children, 5 years, 6 years and
mhm.
above, if they can sit in that steam chamber or cover themselves up and try and inhale and clear their sinuses, nothing like it.
Great. And what about dry, prolonged cough? So we've seen this sometimes that, kids get a viral, they get a throat infection or a cough. Phlegm has now gone, they're not spitting up phlegm anymore. But almost for 2 weeks after that, there is this constant dry cough. So when they try to eat or they try to run or they try to play, they constantly break into these small bouts of a dry cough.
Correct.
So what do you think is the best treatment for that?
So dry cough is initially, to start with, when the child has dry cough, uh, generally whatever cough syrup your pediatrician prefers to give you, like whatever it is, like an Alex or a Tixilix or a whatever it is, should be tried to begin with. And generally, this helps in at least reducing the severity and intensity of the cough. Some
Sure.
children may have a prolonged cough, so you have to make sure that his nose is not blocked, or there is no persistent trigger like a painting in the house which is going on or something like that. If all those things have been eliminated and the cough is the only thing which is really bothersome, then you can get evaluated by a doctor and see if the child needs any inhaler, or if the child is wheezing, or if there is a family history of asthma, that is the child having an allergic bronchitis, and that kind of cough generally settles with either a nebulizer or a inhaler at the end of the day. But
Sure.
otherwise, it will generally, the virals which are going on in the last 3 years, and especially in the last 3 months, like last 3 years was only COVID, but
Yeah.
last 3 months has been a cocktail of COVID, the flu,
Yeah,
the
absolutely. I
uh,
was going to come to that as my next question, that when will parents see the end of these viral infections?
yeah, so this cocktail has really worsened the cough in children to a great extent, and we are generally seeing 10 to 14 days as a period, for how long the cough lasts. So don't worry if otherwise the child is fine, if the chest is not moving fast, if the
Hmm.
respiratory rate is not high, if there's no fever, if the child is not dull, if he's eating well, sleeping well. Try and elevate the head end of the bed while the child is sleeping to some extent. You can
Okay.
probably put a triangular pillow, kind of changing the anatomy of
Yeah.
the tract. You can try some soothing home remedies like honey or ginger
Okay.
or hot milk or whatever works for the dry cough, because there is no definitive solution for the cough. It's basically your airways are bruised by the viral, and as
Okay.
your airways heal over a period of time, which may be anywhere from 3 days to 3 weeks, the cough may last. Best is to start with a cough suppressant to give him
Okay.
something hot, and then if required to show your pediatrician whether they need an inhaler or a nebulizer.
Understood. Dr. Miti, one more thing that I've seen. I mean, I also go through, and I know because of me inherently, my son has is a lot of allergies. So what happens is usually when he gets up in the morning, he has a runny nose, or he tries to clear his throat a bit. So one is, how does one test for allergies in these young babies? And what do you think is a long-term solution? Because always using anti-allergens is also something that is not, I'm not very comfortable with myself as a mother to give him Allegra or give him Monter all the time. So
Sure,
one is, how do we kind of narrow down to what allergy it could be, and
sure.
second is, what is the treatment of these allergies for children?
Sure. So, uh, when the child, first you think that, there is a family history A to begin with, or even not, that, the child is constantly having a running nose, probably more frequently, like as I said, 6 times a year is fine, but 20 times a year is not okay.
Okay.
So, if the child is having persistent symptoms over a period of time, there can be a basic blood test which is done, which is the serum IgE levels, to
Okay.
see if the child is generally allergic or not. Okay,
Okay.
the normal values range between 200 to 300 is acceptable. So if you know that the value is around 500, 700, child is mildly allergic. But if there are people who have values of 2000, 4000, 5000, which means he has an allergic prodrome. Now, in such a child, once you find out with the blood test that yes, and you mind you, parents don't subject the child to a blood test simply for this.
Yeah.
Only when he's doing it for something else you can get it done, because
Okay.
we are not going to get an immediate solution for it. Once we know that yes, this child is allergic, we can do further blood tests or skin tests to know the inciting substance, but it's really quite difficult to, stop most of the substances in children. For example, say tomato or milk or, some dairy
Yeah.
product or cheese, and it's very difficult to keep the child off it.
Hmm.
So we do have to try and find out if there is any particular thing which, which is causing some allergies. Don't directly stop your curds and milks and
Okay.
chocolates and all for your child. Try and find out um, anything particular, like some, maybe some peanut or some fish or some egg or something which is very particular, not the substances which the child consumes on a daily basis.
Hmm.
And uh, there are skin tests, there are blood tests to find out the allergens, but generally those are given when the child is not improving in spite of medications. If
Okay.
child is doing well with short term medications for 5 days, 10 days, then generally we don't find out. Unless child is a little elderly or really sick, we don't really work up further for finding out the cause of the allergen. And it is safe to take anti-allergics, probably not every day, but every time the child has an episode, like say once in 15 days also, for example, it
Hmm.
is quite okay to give him an anti-allergic for a couple of days, because the child is still growing, he's still very small.
Hmm.
Once he will get over this phase, once he will cross 6 years, and then once he will cross 12 years, these
Hmm.
are the boundaries which we consider generally to
Hmm.
fight off major illnesses. Like all this, what we see in these 3, 4 year old kids right now, 2, 3 years, will go off by the time they are 6. What we
Hmm.
see in the 8, 10 year old kids, the wheezing, the asthmatics, will
Yeah.
get better by the time they are 12. So we
Okay.
have to give the time to the child to fight on its own, time to probably not stress the child. If he doesn't want to go to school in those days, you can just ask the child to relax, not send him to school. Give him what he likes to eat, even if it's just a pasta, or even if it's something healthy, as long as he's eating something when he or she is sick, is fine. Hydrate well, and
Hmm.
okay to medicate on and off.
Hmm.
There is no,
Hmm.
no harm in it.
Sure. Also, another question, that I think I mentioned it earlier, which I'll come back to, is that when kids are have a cold and a cough, a chest congestion, they find it very difficult to eat food, which is,
Correct.
a very big cause of concern for parents, because for as parents we can't see our children not eat. For days together, they just tend to not eat, right? So I know you mentioned that there's a virus has given some throat irritation, which is why they could be, but is there anything you recommend to parents that we can give, that even if they're not eating well, some foods that could be better, more soothing? As a mother, when you face this, what do you give your children, to eat when they have a cough?
Sure. So, first of all, whatever he eats, he doesn't eat. Make sure he has a lot of water.
Hmm.
Okay. Even though if the child will not eat for 2 days, he is going to be fine. Okay. So don't stress yourself. Make sure he has his water intake, because dehydration can cause the worst of things. Otherwise, he will be fine. Secondly, give him some, liquidy diet. Give him juices. Give him soups. Give him semi-solid mashed foods like khichdi.
Hmm.
And even for that matter, give him his chocolate, or give him, of course, not flavored items, not colored lollipops, or not colored gems or stuff like that, but a simple dairy milk is something he can have, and if that fills his stomach, there is no harm in it. That
Got it.
nowhere in literature it has been mentioned that a chocolate, a dairy milk will
Yeah.
cause a cold.
Yeah.
Yeah, so colored items do trigger, but not that. So give him that. And then you give him small, frequent meals. He may not eat his normal 3 idlis, but he will eat half a idli. Let it be. Let him eat half his idli. And just let him be. As soon as he becomes hungry after 2 hours, 3 hours, he will ask you for whatever, and give the child whatever he likes. Don't try to enforce his daily schedule of a breakfast, roti, sabji,
Okay.
dal, rice,
Okay.
and an evening dinner or a soup. No, give him whatever he likes. If he likes a pizza, please give it to him. If he likes, because at that point of time, what is more important is he eating,
Yeah.
and with his eating, he will sleep well. If he sleeps well, he gets better faster. If
Yeah.
he doesn't eat, he doesn't sleep, he gets crankier. It just aggravates his cough and cold.
Got it.
So if whatever the child prefers, sometimes even if you can try it, it's worked for my children. A juice of cold, orange juice, but a little cold. I know, unless the child is really getting triggered by it, but if you just give him a huge can of orange juice, fresh orange juice, they love it, and
Oh,
that
wow.
fills their stomach and they feel much more
Yeah.
energetic.
So
So
actually, that's a big concern, right? Because when your child is sick, at
yeah,
least that's what we've been told by our parents that dahi mat do,
correct,
juice mat do, orange mat do, grapes mat do, kuch bhi sweet mat do. So,
correct.
for us, we're like, okay, khichdi bhi nahi kha raha hai, sweet bhi nahi dena hai, so, what should we give, So that's
Yeah.
another thing that there are so many myths around the food that a child can eat.
Yes, so anything natural, I am a big fan of fruits. And you can read up, they have the best antioxidants and vitamins that anything else. And may it be any fruit, especially grapes, especially oranges, especially custard apple, especially pineapple. All these things which people are against giving children.
Yeah,
Please
absolutely.
please don't stop your child from having those in whatever form they like it. Of course, and bananas,
Yeah,
so
yeah,
many
banana is
benefits.
a big one. Everyone's like, no, no, banana se cough banta hai. Yeah,
Absolutely not. They are the safest thing to have. They
okay.
are the best thing. If of course your child likes it, of course, if he likes a papaya, apple, pear, very good. But if he is sick, he may not like it. So you may try to make a smoothie of these. But if he wants to eat two big oranges, please give it to him, and he'll be fuller, he'll be happier, and he'll be much better.
So one biggest question that I have, which I'm sure all parents have, is does eating ice cream lead to cough?
Um, yeah, it's a tricky question.
Okay.
Yes, some children who have asthma or who really have a tendency of wheezing do get triggered not by the ice cream but by the chilliness of it. Okay, it's
Hmm.
so cold that it triggers a spasm in the airways. So you in those children who require frequent nebulizations, who are on inhalers, they should avoid ice creams if possible. But if the child is suffering from any other viral, like your child is just getting a cold on and off or a cough, I don't think an ice cream triggers it or anything like that. And please give it to them.
Great.
Probably not
Um,
when they're sick, but as
yeah,
soon as
when
they're
they're
better,
better. Yeah.
they
Another thing is that according to you, obviously when they are sick, we take them to the doctor and we get those, temporary medications and they are fine after a few days. But according to you, as a chest specialist, do you think that there's anything that promotes good respiratory health in children in terms of immunity? What are the foods that we can give them on a regular basis that helps, build that immunity?
Sure. So I had just give me a moment. So in general, okay, what is immunity is what we all saw in COVID, what people were getting: zinc,
Yeah,
vitamin
yeah,
C,
yeah.
and vitamin D3. Okay, so
Okay.
you think that helped fight COVID? No. What it did was build up the immunity. Okay.
Got it.
And
Got
of
it.
course, what we were advised is to have good protein diet. These are all the common things. And if you do want to know the good words, it's the antioxidants, the beta carotenes, all the vitamins A, B, C. So basically, immunity is your body stores are replenished with the micronutrients which they need, and if the body stores are good with those things, the body has the immunity or the ability to fight the infections faster and better. So as such, there is no particular food to build up the immunity, but I'll there are certain foods which are good, which I had just kept made a list for you guys. Anything related to broccoli is good if in
Okay.
whatever your child likes it. Even it may be with a pasta, it may be with a pizza, or it may be plain boiled broccoli. Broccoli is very good for your body. Milk, again, very good. I don't know how many children nowadays have milk. My children, one child loves it, one child hates it.
Yeah,
So,
yeah. Milk is
uh,
a big topic of discussion these days. No, dairy is
so
a big topic of discussion.
overall, also not just for us,
Yeah,
right?
yeah, overall, yeah.
So milk is of course good. Almonds is very good in whatever form child you can give your child. Eggs, if y'all are non-vegetarians and if you'll eat eggs. In fruits, papaya is very good. If a child has a papaya and it's almost available around the year, probably you
Yeah,
can give once every week. Even if they don't like red bell peppers are full of antioxidants, so they are something which you can include in your menu. Citrus fruits, as I said, I'm a big fan. Oranges, sweet lime, tangerines, Malta, whatever it is. Dals are a little difficult. Child may not have as much, but if you can give a dal khichdi or probably in sambar or in
yeah,
whatever form,
yeah,
a chaat, like a moong chaat or a
yeah,
chana chaat, something like that. Carrots are good. Spinach is very good. Spinach can be added in your parathas, in your theplas, in your
yeah,
khichdis. Very good. And just basil, if the child likes. Turmeric, of course, our
yeah.
Indian, most of
Turmeric
our Indian,
ginger goes a
yeah.
long way, right? In helping with
Yeah, and salmon fish if people are eating non-veg. And
got it.
yogurts, and not to forget avocado, the latest.
Yeah, yeah.
Yeah, so
Uh,
all these things are good. Whatever suits your child and likes is liked by your child.
so all these foods coupled with maybe a decent, a good multivitamin or a D3 can help at least cover our base. Then we can just hope that they don't get a severe infection and their bodies
And
can
mind you,
fight
these
it
all
back.
things are to be eaten when the child is fine. Immunity is not
Yeah,
only built when the child is sick. Immunity is built when the child is well. So, your child is well, don't keep him on junk. Don't let him eat everything. Make sure
yeah.
to include one of these items every alternate day in whatever form possible. And over a period of time, 2 to 6 months or 2 years, your child's immunity will get much better.
Got it. Another thing I wanted to discuss, is vaccines. So I know that currently, there are a lot of cases of influenza H1N1, and while
Sure.
we don't, a lot of kids don't fall into that category to get a COVID vaccine. A flu vaccine is definitely something that we can consider. So because even pediatricians have a very different opinion. Some pediatricians are very pro vaccine for the flu, and some pediatricians are like, flu ho jane do, let the body fight it. But I know that in spite of getting vaccinated, my son got flu, and it was 7 days of hell in the house for him, for us. We just could not see him like that. So, what
Sure.
are your thoughts on the flu, on the influenza vaccine?
So, with regards to the vaccine, again, as a doctor, I would say that first is the pneumococcal vaccine. That is the more expensive part of the 10 and 14 week vaccine. जो उसका जो expense आता है 8-10 thousand, a major chunk of it is the PCV, the pneumococcal vaccine. Okay, that is also one of the causes of pneumonia, so that has to be given to the child. And yes, coming back to the flu vaccine, please give it to your child. Better safe than sorry. Probably your child or any other child did suffer from hell and did not got the flu in spite of the vaccination, but at least he didn't land up in the hospital. At
Yeah,
least he didn't have a fever which lasted for 7 days. He probably had a fever for a couple of days, and then it was the post-viral effects.
yeah,
For somebody who was a naive mom, in spite of being a doctor, I had to see my daughter in the ICU at the age of 11 months,
oh my,
so she had a severe bronchiolitis, and Yes, probably vaccine was a different story, but so many children do land up in the ICU, do land up in the hospitals for a viral illness. So yes, vaccines don't prevent you from getting the infection altogether, but yes, they reduce the severity of the infection, they reduce the mortality of the infection, they reduce the spread of the disease beyond a particular point of time.
Yeah.
And once the child grows a little older, they don't need to get vaccinated every year, as is the recommendation. The recommendation is ideally every year, but always check with your pediatrician to check the strain. And like for this year, the strain which is going on since November 21 is going to carry on from November 22 also. So the strain hasn't changed only this year.
Okay.
So, make sure you check with or probably these are quadrivalent vaccines. So out of the quadrivalent, if only one strain changes out of the four, you can probably delay the vaccination for 6 months till the new strain comes. New flu vaccine comes every 6 months. But the
Okay.
strains need to be checked. You need to check from your pediatrician or somebody known or me or whoever it is, what is the strain change in the vaccine, and then probably you can vaccinate every 2 years. But this is applicable for slightly older children above 5 or 6 years who have their immunity, who've already been through a lot of flu episodes in the last 5 years. But for a younger child, at least till the age of 5 years, yes, definitely they should be vaccinated every year for influenza.
So starting at year one, right?
Yes, starting at year.
Starting
So
at
now
year
what
one.
pandemic, it's not a pandemic really, but the number of flu cases which we are having in this August and July,
Yeah.
we never predicted this, right? We knew COVID was there, but we didn't know that so much of flu would come. So
Yeah.
when it will become a pandemic, we don't know.
Yeah.
So better to be vaccinated and make sure things are
Be
fine.
safe.
And yeah, because which virus strain which come will mutation will come. Sometimes they may cause some CNS effects, they may cause stomach effects. We don't know. So
Yeah.
if we have vaccine, it will definitely tone it down. It will make you much more better equipped to fight the virus. And at least till 5 years, have it yearly, starting from year one. After 5 years, based on how your child's profile has been, how the strain changes, and how which part of the world you are living in, you can take a call.
Sure. So there is a misconception that flu vaccine and COVID vaccine are interchangeable. If एक ले लिया तो दूसरा नहीं लेना है. तो also we need to just shed some light on that flu is different, COVID is different, both have separate vaccines and both need to be taken, right?
Yes, definitely both need to be taken. There is a very interesting fact which I have observed and I was reading about it, that all those who were vaccinated for flu prior to the COVID pandemic did, I mean, not all, but a large chunk did well when they got COVID, like adults, I'm saying. Okay,
Mm,
so yes, there is some amount of a cross immunity which is there because eventually both are viruses, and COVID, as we know, falls into the coronavirus, a lot of other coronaviruses also.
yeah.
So yes, the COVID vaccine does protect against flu to some extent and vice versa, but that does not stop you from vaccinating for both because largely they are very different.
Understood.
Yeah.
Uh, any more questions? Just give me 1 minute, Dr. Miti.
So somebody has asked, flu vaccine should be given post 5 years. No, give it from the age of 1 year till 5 years every year. And post 5 years, you take a call on how your child has been over the last few years. And should we wait for the COVID vaccine and give the current flu vaccine? No, it's irrespective of that. You should give your flu vaccine if it is due, and you should give your COVID vaccine when it is due. If you want, you can keep a gap of 14 days between the two to prevent any cross reactions. That's what we generally recommend. Either ways, whichever you take first, you take COVID first or you take flu first, you keep a gap of 14 days, but take it when each of it is due.
Sure. Dr. Miti, another question was a lot of young babies are having a constant runny nose, and after almost a month or so of dealing with this, pediatricians have actually asked parents to stop sending the kids to school or to play group to give them a gap of some time. So, according to you, is that necessary, or is that a bit of an extreme step for a runny nose, for a constant runny nose or a cough?
No, rest will help, but not to cure. Just it's just to give the child adequate time to recover. So there is this theory of I forgot the name for it. As to stop him from exposure as a treatment. No,
Hmm.
he may need some rest, but no, he doesn't need to stop coming in school, etc. And for your running nose, you can ask your pediatrician if a nasal spray will help him. Sometimes it's just such a hyperreactive, irritative nose a child has that, immediately eats something or smell. So probably a nasal spray acts as a coating for your nose. So
Hmm.
one example I would like to give, that inhalers and nasal sprays are
Hmm.
like chappal for your feet. Why do you wear chappals? You wear chappals because you go out barefoot? No, you wear your chappals and you go out so
Hmm.
that nothing irritates your legs, nothing hurts your legs.
Yeah.
After something does hurt your leg, how much ever band-aid you will apply or how much ever you will do, it will take its time to heal and it will be so difficult for you to walk.
Yeah.
Same way, if you require it, a nasal spray or an inhaler is like a chappal for your lungs and the nose. Okay, you may need to wear it and go out for a few days or a few months if your child is having a frequent episode. And what
Yeah.
that will do is it will provide a coating on your airways, which will prevent new things from irritating it and aggravating it. And then you may not need it. Generally, if a child, unless he is really unfortunate, will not develop a severe asthma if you treat it with the right inhalers or nebulizers at the right time. If you don't treat it, okay, if you
Hmm.
let it worsen, if you let the spasm worsen, the asthma will surely develop. So
Hmm.
if you treat it, it will go away.
Understood. Uh, there is a question, if you can just see in the chat section by Miss Hina.
Yeah,
Um, I think her son is taking Bucodor 200 mg since November last year and giving
mm,
Monter and Sedzine daily.
sure.
Is it okay?
Yes, and it is November last year, which makes it almost 10 months now. Yes, ma'am, it's fine that he is taking it, but have you tried weaning it off, or have you tried reducing the dosage or making it alternate day? Does he get sicker if you do reduce it? It should be fine if he requires it, but generally, 9 to 10 months is a pretty long time. So what is the reason that he's requiring it for that long time?
Sure. Another question is, it's, one parent's son gets a ear infection due to cold, and he has a sinus and allergic problem to pollen. Basically, I think because that's a Bangalore problem, pollen. Um, is there any way to prevent it? Can we put oil in ear and nose?
Please don't put oil in your and nose, parents. You are making it. It's like putting kachra in your mouth and ear and nose. So please don't put any such thing. Yes, lot of nose sinus infections can partially block the eustachian tube, and that can cause ear pain, fluid in the ear, a lot of other issues with regards to the hearing. But as soon as the nasal infection does get settled, his ear will also settle. So, what is best advisable at this point is to use a nasal spray and to take steam. And if required, to take an oral anti-allergic like
Oh,
a Montelukast levocetrazine.
okay. Um, Also, do you, in your opinion, do you think that a strong AC, air conditioner at home or at school affects the respiratory system for children?
Um, Again, tricky question, but yeah, yes, it could be. It
Okay.
could be air conditioners. do have a lot of, but I'm sure the schools do take their measures to keep it clean and to
Yeah, so
kind of
purifying, cleaning the air conditioner from
yeah,
time to time, getting it serviced, so that
very
that is
important.
important.
Yes, yes. Some children do get sicker in a class where there is an air conditioner, or even at home for that matter.
Mhm.
But not everybody. First, you exclude all other causes, and then if that is the case, you could request the class teacher or request the his classes if
Mm,
they are serviced regularly. It
mm,
could in some children, but as I said, some factors are very difficult to
mm.
control, or
Control. Yeah.
yeah. So if that is the case and you feel that is happening, you may ask the pediatrician if you could say take some medications for some time and which would
Mm.
reduce his allergies.
Sure. There is one more question in the chat for the pneumonia vaccine. So that has been given at 6 months. Do we need to give the meningococcal vaccine? Can you just
You can
address?
ask your pediatrician if possible
Hmm.
regarding the meningococcal vaccine. Not the best judge to
Okay.
give.
What is that? What is the meningococcal?
So meningococcal vaccine is more like a H influenza B, and these are other infections which can cause a respiratory infection, but majorly they cause CNS infections, meningitis, and it is one of the organisms, Streptococcus and Meningococcus. So same way how we have flu vaccines, these are other vaccines to prevent meningococcal CNS infections.
Hmm.
Whether the vaccine is recommended at 4 years, I'm not really aware of.
Okay. We have one more question. How many days after a child has recovered from a viral, can they get the flu shot? So you think how many weeks should one
Two
wait?
weeks. 2 weeks is
2 weeks.
ideal.
Okay, 2 weeks is ideal. Okay.
Yeah, don't give
Um,
immediately because sometimes the vaccine triggers a bad body ache or a cold again in a child who is in the what do they call convalescent stage of the illness when he's still recovering.
okay. Best practices and medicines during coughing during sleep. I think we addressed this earlier, but you mentioned, right, that one
Yeah,
can elevate the level of the head.
yeah, one can elevate the head end of the bed. One really needs to check once if a child needs nebulization for a couple of days. Cough syrups, anti-allergics like a Montelukast levocetirizine really works well for some children. I would like to tell you that Montelukast levocet is available in tablet form also, which is a kid-friendly tablet, chewable, dispersible tablet. And as per my experience, the tablet form works much better than the syrups. The child likes to take it also. So that is something which we can give. And cough syrups are, more of a trial and error sometimes. Like even it's not that the pediatrician is playing games with you, but some syrups work well for some
Yeah,
child and some
yeah.
some don't. It's really difficult to control that cough because every time we can't put a child on nebulizers or inhalers, but whatever cough syrup works well for you, elevating the head end of the bed, keeping meals smaller, a little smaller at night time. So even if they cough, they don't puke it out. Uh, and probably an anti-allergic if required.
Sure. The parent who was giving the inhaler and the Monter earlier, when you asked them if they have taken a break, the parent has replied saying that they've reduced inhalers, but then he starts wheezing and coughing again. So she's stopped the inhaler, but is continuing to give him Monter and Sedzine, which controls his cold allergy.
Sure.
So it's been
So
about 10 months now on Monter and Sedzine.
sure. So what at this point, what you can do is probably the Budecort now needs to be changed to something with a bronchodilator, like a Foracort, which has a combination of budesonide and formoterol. Okay, it's a dual bronchodilator now because a plain Budecort is definitely not working. So when we take a combination inhaler, his airways get better dilated, and then we can consider tapering it off. So you need some upgradation because I'm sure a child can be tapered off it 99% of the times. If we need to up the medicines to stop it. You
Hmm.
don't need once the child reaches his optimum best, then we can slowly taper it off.
Okay. In asthma, omnacotril is the only option for allergy, even if we give inhaler.
See, this is a big topic, but Omnacotil is a steroid. It's prednisolone basically, and yes, some allergies, some asthmas don't get better despite inhalers. But mind you, this only happens when inhalers are started very late, when the
Hmm.
child is already very sick. Child is already not taken medicines for 5-10 days. He has a severe infection, and at that point, he may need Omnacotil, which is prednisolone, so
Hmm.
that it breaks that spasm, it breaks those allergies. But if you feel that the child is requiring omnacotil time and again, which means he needs to be on a regular chappal, which I mentioned, his regular inhaler, so that the requirement of omnacotil will not come into the picture. But yes, if in an acute situation, if you need to take it, also keep in mind that steroids are not harmful when they are given for a short duration of 5-10 days, even up to 3 weeks. The
Hmm.
side effects of steroids do happen when they are taken for more than 2 to 3 months. For child, if we reduce it, then at least 1 month. So if
Hmm.
your pediatrician feels, or if you feel child is really very sick, don't be adamant that I will not give omnacotil. Give it for the short duration, and once the child is better, immediately show your doctor, and see what can be done to prevent such an episode in the future again.
Sure. And according to you, these children who have these prolonged, dependencies on inhalers, who have asthma, who have allergies, what, according to you, can they not do in terms of their daily life? That is swimming okay, for example, or taking up a sport where a lot of running is required. So, should that be left upon the child and their ability? Or do you think that there are some things that, there are absolute no's for these children?
No real absolute no's,
Okay.
except that if your child is unwell, don't take him to an enclosed play area. These are the worst enemies for a child, because they are enclosed, they are frequented by children, they are dusty, and they involve a lot of jumping, which your child may not be fit to do at that point of time. So, a
Mm-hmm.
play area, an indoor play area, is a strict no in terms of taking your child out when he or she is unwell. Even though if he is an asthmatic, he can go, but not when he's unwell. In terms of activities, take it slow, take it easy. See what your child likes. Don't force him into anything. Some children are not meant for running. They are not meant. They are not meant for swimming. They are not meant. So we can't force the child. See what your child likes. And yes, if say the child likes swimming, for example, start it gradually. I am sure he will. It will not be something which will worsen his asthma in the long run. Initially, it may be for a couple of days, he may feel more breathless, he may cough more, but he will develop a resistance to it. And
Okay.
we really advocate for a slightly elder child, maybe 5 years and above. And say because generally at 6 or 7, we can label a child as asthmatic. We can do a PFT in that child. Generally, below 6, we don't do it. But at a 7, if we say that this child is asthmatic and he likes to swim, he likes to do activities which can improve his respiratory capacity, like play lawn tennis or play basketball, we tell him आप आपका inhaler लेके वो activity करने जाओ.
Oh,
So
great.
morning he takes his inhaler, say at 10 o'clock before his class, and
Hmm.
then goes for the activity. And if he does that over a prolonged period, slowly his requirement of inhaler will come down, because his lung capacity will take over, and he may get off it. But initially, if he needs to take it and go for it, please go ahead.
Got it. Got it. Also, Dr. Okay, I think we've pretty much come to the end of our talk here. It was great having. I think we've covered most of the questions. So just some key takeaways that I just like to sum up, because people are coming in and going, is one is definitely get your child vaccinated for flu and COVID if those are available and your child falls into that category. Second is that asthma is not a limiting disease, and your child is capable of playing sports and medicating at the same time. So taking care of that. Third is that virus cannot be contained, and parents just need to cope with it and live with it with their children and give them the right medication and the right diet, and not worry too much, because this is almost like another sort of wave that chest physicians and doctors are seeing, where there are multiple viruses going on right now.
Yeah.
And our kids are constantly sick, they're constantly infected with something, but it's not something to worry about. We just have to go over this tide and deal with it.
And it's
Um,
not just your kid. You see every other kid,
yeah,
it's every
every
other
kid, yeah,
kid.
every kid is unwell.
Yeah, and
Um,
that does not stop them from going to school, mind you, because their growth development is getting hampered if you keep them at home just for a viral illness.
yeah, yeah. So two, three
Of
days
course,
of
not
rest.
when they are acutely sick, but
Yeah,
gently. Yeah.
2 to 3 days, I think, is a good time for them to rest it out and then resume school, right? A long break is not required.
Yes. Yes.
Understood. And a good and healthy diet with good multivitamins, good immunization is going to help parents and children in the long run.
Yes.
Okay, perfect. Thank you so much, Dr. Miti, and thank you to all the people who joined this session. This was amazing having all of you all here, and we'll do a lot more in the coming months and weeks. But have a great day and have a great weekend, everyone. Thank you.
Thank you, everybody.
Thank
Thank you
you.
for joining.
Thank you so much.